Hi guys, please ignore my lovely sick face that I have going on here. I have somehow managed to catch the nasty, yucky cough, cold, flu junk that's going around, and I hate that I can't be there with you guys today, but I do not want to share my germs. So I wanted to quickly go over a few of the things that would be reviewed in my bay today so that you guys have this to refer back to while you're studying for your exam. The first things are making sure that you're taking a good history on your patient. So always asking those 2 history questions would be very important to start your exam. So asking if they have any history of chest pain or cardiac disease in their family, or if they've had any trouble breathing, any of those would be applicable for this history taking session. The next thing that you would do is we're going to just review some anatomical landmarks so that you would know what you need to be assessing when you're looking at the inspection and palpation of your patient, the cardiac assessment. So I made this little cheat sheet for you guys so you can see it. So the first thing is the precordium, and the precordium is the entire section of the heart, the whole part of the chest that the heart takes up. The heart extends from the 2nd to 5th intercostal space, from the right sternal border over to the left mid-clavicular line. And when we say mid-clavicular line, we mean that when your clavicle is here on your chest, that you just draw a line straight down the middle. The next part is the apical impulse. This is also the location of the mitral valve when you're auscultating, and that would be on the 5th intercostal space, left mid-clavicular line. The third is the carotid arteries here in your neck, as well as the jugular venous pulse. When you start the inspection for your patient, you want to always make sure that you're checking their skin color, their nail beds and lips, and then any edema or labored breathing. And I just noticed that this is actually going to be backwards for you guys to read. You need to know that when you're doing your patient's assessment, you want to make sure that their lips are nice and pink, that their hands and fingers are nice and pink, they're not having any labored breathing, or they're not having any struggling to breathe, and that they can complete a full sentence without having to take a breath in between. The next part we're going to do is inspecting the anterior chest. So you're looking at the chest to see if you find any pulsations, heaves or lifts, and any visible aortic pulsations. So when you're doing these, the heaves or lifts are what if you put your hand on their chest, you would visibly move your hand up off of their chest. Their heart is beating so hard, or they have a murmur that's causing that. When they're having a visible aortic pulsations, that would be here in their neck, that you would notice a visible pulsation there. The next part that we're going to go over is the inspection for jugular venous pulsations or distensions, and I will send you this so that it's a little bit easier for you to read as well. But you're going to stand on the right side of your patient and have them lying 30 to 45 degrees, laying supine on their back. You're going to remove the pillow from their head and have them turn their head slightly away from you, so over to their left shoulder. And as you remove the pillow and have them turn their head over to the left shoulder, you can shine your pen light against their neck here, and you should be able to visibly see pulsations in the neck. As the head of the bed elevates, you should see these veins flatten and disappear. If there is unilateral distension of the veins, so the veins are only distended on one side, that would be caused by a local issue, such as an aneurysm or a carotid artery blockage. If you've sat the patient up above 45 degrees and there is still distension in the external jugular veins that you can see in their neck, then that means that they have an increased CVP, or central venous pressure, and that could indicate heart failure. These distended veins will be here in their neck, and a lot of times they look like little ropes going around their neck there. When you're palpating the carotid artery, you want to make sure that you're only palpating one artery at a time, one side at a time, because if you include both at the same time, then you could potentially cause your patient to pass out. When you're listening to the carotid arteries, you're going to listen with the bell of your stethoscope, making sure again that you only listen for one side at a time and asking your patient to hold their breath while you're assessing the carotid arteries. You're listening for any bruits or harsh rush sounds of blood, so a shh. If that could mean that there's a blockage there, making that artery very tight and hard for blood to get through. The next part, let me see, and that's a bruit. That's called the bruit. The last part is palpating for the apical impulse. This impulse should be located between the 4th and 5th intercostal space near the midclavicular line, so going right down the middle, nipple line. And it should only occupy one intercostal space, so about 1 to 2 centimeters. I'll be sure to take a picture of these little sheets that I've made so that you don't have to read them backwards. I'm using the front camera of my computer, as you can tell. So, but whenever you're palpating this apical impulse, you just want to make sure that it's in the location that you would expect it to be. So the 4th or 5th intercostal space, left midclavicular line, and you want to make sure that it is only occupying 1 to 2 fingertips, so 1 to 2 centimeters. If it's bigger than that, then you're concerned that there may be a possible enlargement of the heart or a left ventricular hypertrophy. So I have a little baby doll that I stole from Claire to help you guys really to visualize these things. So for your precordium area, that's going to be this entire area here on the chest. This would be your right sternal border, left sternal border, and then midclavicular line would go right down the middle there to the middle. So your apical impulse, if you're looking at the baby from my side, would be here, right above nipple line in the 4th to 5th intercostal space. So when you're auscultating for that, you want to use the bell of your stethoscope and listen here at the 4th or 5th intercostal space, left midclavicular line for 1 full minute if you're auscultating for the apical impulse. When you're auscultating for or palpating for carotids, you would listen here, the neck, one side at a time. I could do it myself. Here. Then you ask the patient to hold their breath as you auscultate so that the breath sounds do not interfere with any possible bruits that the patient may have. For the jugular venous distension, you have your patient lying on the bed, and they're like at 30 to 45 degrees, and you're shining a light on their neck and asking them to turn their head so that you can see the jugular venous pulsation. And as you raise them up in the bed, that vein should lay down and be flat. If it is not lying down and being flat, that means that it's distended to some degree, and that could indicate an increased central venous pressure, CVP, or be heart failure indication. I hope this helps a little bit. I will be holding a makeup lab on Friday for you guys, and I will be there from 9 to 12. I'll let you know the location as soon as I can figure one out so that I can answer any questions you guys may have from today. And I'll be sure to send pictures and attach pictures along with this video to my little note sheet so you don't have to read them backwards. Thank you.